Good day. Welcome to Hunny Walia shows. I'm your host Sonal Fool. In past and present, and what we always have done, we have brought the different entities, different professionals to talk about the issues which really matter to us. We have talked to the doctors, we have talked to the young entrepreneur, we have talked to the politicians and discussed the issues which matter. Today we have Dr. Aulakh with us. I'm going to read his degrees because he has MD, FRCPC, DABAM. I'm going to talk about what these degrees are. He's a qualified psychiatrist. He's a licensed to practice in Alberta. He's also medical director at Serva Medical Center, which specializes in addiction and mental health issues serving South Asian community. Welcome, sir.
Thanks, Sunny, for having me. It's my pleasure.
I'm honored, sir, to have you here because, as a psychiatrist and a mental health is an issue which we cannot, judge. No one can judge it. You have to identify it. You have to accept it, especially in South Asian community. So I have a first question because in South Asian community, male sector or male, we never say we have the issue or we don't accept we have a mental issue or we are suffering. If we talk about any drugs or addiction, it can be easily measured, but mental health not. And you are specialized in South Asian community or dedicated to South Asian community, what your thoughts are on South Asian community, male sector or male segment mental health?
I think you brought up a very pertinent point, Sunny. When we are talking about the mental illness, no community is immune from the mental illness. We are as vulnerable as any other communities. I think it's less recognized and less accepted in our community, and because there is a little bit of more cultural connotation, cultural background. Because historically in these communities, mental illness was perceived as a mental weakness, which is not the case. Mental illness is it's a disease, illness like any other physical illness and a very treatable illness. So addiction, mental health, there are a lot of overlap between. Sometimes mental health is the contributor factor to the addictions or vice versa. It is underrated, underappreciated in the community, but I think we are making inroads. Now more and more people are seeking help, whether it's males, females, young, child, or elderly. That is another extremely vulnerable population.
So we are talking about vulnerable population, right? And especially when the parents or the grandparents, when they come from India, language is barrier. And I will tell you the whole experience, like my personal experience too. My mother, she's gone now. But when she came to India, like Canada, and everyone is gone, work and everything, and the kids have gone to the school, she usually sit on the front of the window and count the cars or, even the people. So how we can keep, and she will get depressed, right? Like, there's no one to talk and the language is barrier. She cannot go outside and, feel secured. And safety was an issue too. Like, you can't just let her go on her, and what happened if she get lost? Especially in our elderly community, like, the parents and grandparents who have a language barrier and the winters, how we can keep, what we can do to keep their mental health up.
So I think there are a few things that can be done. So I think we have to take an approach on our different segments. One is a societal approach, then the professional approach, and on an individual level, what we can do. It's when particularly elderly people immigrate to the Western countries or Canada, it's a big cultural shift, language shift, and there are lots of social connections. I think on a personal level, even just having a regular discussion, we understand we are busy in our schedules. If we can find some way, just having a routine discussions that at least they feel that they are heard, and that is quite impactful. But in this COVID times, I have realized, which I was aware, but how much central these temples, gurdwaras are to our community. They are providing much more relief to these elderly populations. Since they have been shut down because of the COVID, I have seen much more elderly populations coming to me seeking help, because they played important part not just in the spiritual religious aspect but the social aspects as well. And so those are the avenues, kind of like utilization of whether elderly societies, they play important part in it. But also kind of like from the healthcare perspective, that's why I opened up the clinic, because even though the services exist, but there was a gap in services where the services were not offered in the language and in a culturally sensitive manner. So when some seniors are connecting with me, my treatment modalities are no different from any other, but the way they can connect with me on a personal level, on a cultural level, that makes a huge impact.
So you did mention about your clinic where you are treating the elderly people, vulnerable people. Please tell us more about your clinic so the viewers know what services you are providing, how to approach you, and what they can expect when they come to clinic.
So going back a few years back, my area of work primarily was in addiction medicine. It still is in addiction medicine, which is part of the psychiatry, so mental health and addiction. I was chief of addictions for our Edmonton zone. But I noticed, despite me doing a lot of work in the community, uplifting the services, opening up the new avenues for the Edmontonians, our community was not seeking help, and there were few barriers. One was the location was important, and they didn't understand how the health system operates. Language, culture, they were the big barriers for them seeking help despite services being available. That's why it pushed me to open up the clinic, which will provide the services in their close vicinity where majority of the South Asian population reside, but also most importantly where people can speak their language, they understand their cultural sensitivities, they can understand where they started from, so they can connect better. Yeah.
We are talking to Dr. Aulakh. He has a clinic in Southside, and he's basically dedicated to provide mental health if anyone is suffering from addiction, to help them to get improved, get better. Dr. Aulakh, the next thing is, it's very easy, it's very complex thing. Yeah. It's not easy, it's very complex. When we say mental health, right, it's a stress level, could be economical, could be sexual, yeah. It could be anything in the family matter, the kids growing up, kids leaving even the house, like in our culture, the parents, especially the mother, is dedicated to look after the kids. And when they are 21, 22, 23, they start moving out. It's emptiness there, and no one realizes it. And then, it's a depression increase, and then it, increased in a different levels, and it affects your health. So in our community or in journal, how we can help or identify the person is going through?
I think first of all, like that, this process starts from your family doctor. There are counseling services available. Even at our clinic, we have a dedicated counseling services, and even if you're not connected with the clinic, anybody from the South Asian can access. And this is the pilot project we have initiated with Grey Nuns Hospital. I think important aspect, Sunny, you have brought out is the mental health stress. What is the definition of it? And I think to an extent, because it has become so common terminology in journal day-to-day life, people don't understand. So sometimes kind of like, oh yeah, I have had a tough day, I am under a lot of stress, but they're fine next day. There was a minor stress, kind of like, so they are the people who have got good resources, good support system. They don't need anything beyond that, and some of is expected, kind of like if you lose a job or other. But and same thing, for example, you drink a coffee, and people say kind of like, oh, I'm addicted to coffee. But addiction is a totally different thing from kind of like having a regular coffee. Kind of like addiction comes with consequences. So I think sometimes these common terms actually, sometimes it helps, sometimes it actually, because then the average people cannot relate what they are talking about, kind of like, whereas kind of like for other person, stress is more, they're feeling so depressed, they can not move out of their bed, they cannot go out, kind of like they're not getting pleasure of anything. They are just so burnt out, kind of like they cannot even think about kind of like anything that in the future, kind of like any positive, everything is negative. So that will be far different from anybody like me saying I have a long day, I kind of like was a stressful day, but I sleep, kind of like feel fine, kind of like next day. Yeah. So identification is the key, and sometimes also in South Asian people we see that there are a little bit of variations how the presentation is, whereas the mainstream communities are very good at presenting, kind of like they are very good vocally to express themselves how they are feeling, how kind of like our people are not good at it. We have not been historically taught, and our depression, anxiety might represent differently. Kind of like it might be a headache. I am having pains, aches, kind of like, yeah. But this is where kind of like the professional help is required. Yeah.
Now, Dr. Avi, I have another question here too. Like, I'm a safety professional,
Yeah.
right? Occupational health and safety. Even in OHS also, like Alberta OHS and the other provinces OHS also, they have recognized this as a issue.
Yeah.
Mental health is an issue. So they are even offering if you have mental health issues or you are going through something, we will give you modified work. And what we have, is part of the legislation also, not only the medical term, but the legislation for the work side also, right? So they can help from both sides. My question is like, when we are talking or discussing, like, is an issue there? And when we have seen the recent stats, a lot of young students who have come from India or from South Asia, they have committed suicide. The violence has increased because of the pandemic,
Yeah.
everything. So is any way, and is a very gray line to when to cross and how to cross it too in our community, right? What is the easiest or I should not be saying easiest, earliest signs to catch up or able to help them or support them? Reason being why I'm asking, if I come to you, are you stressed? Do you need a mental health? You said, leave me alone. Are you crazy or what? But is there some kind of a steps or the signs you can catch up? Okay, this is leading to that.
I think like mental health is such a broad category. It's kind of like various things can manifest as differently. So it's not kind of like one symptom that we can target and identify. But generally, I think loved ones, your peers are the first one to notice changes in behavior, changes in performance, isolation, agitation, irritability. These are some of the signs and symptoms, and these are mostly noticed by people who they are living with or who have been working with them or they're studying together. I think those will be kind of like, I think even addressing directly with the patient, kind of with the person, is helpful. And there are distress lines. I think our community particularly underutilizes those. And most of the cases can be solved at those levels. Not everybody needs to be seen by the doctor, but if at least some appropriate steps are taken, like there is a crisis lines, like they have dedicated people on the phone, like sometimes having that phone conversation like can lead to like some positive outcomes. Yeah.
And doctor, I have to say something, right? Like being in a profession, safety profession, we always talk, have you have a first aid training?
Yeah.
What do what emergency response trainings you have? Do you have first aid? Which level do you have it? I have recently completed the mental health first aid. So it actually opened my eyes. So first aid course is 2 days, and then mental health first aid, which is 3 days, is two different components. What you think should be encouraging to have this also to our generation or to our people or to our community, or should we be offering this course also?
I think that's a great idea. Kind of like if we can offer to the community, that can be of immense help. And also, I think recognition of emotions is the key. Kind of like sometimes we are not even able to identify the emotions. Yeah. And where it becomes a little bit of complex is also the vocabulary, the dictionary, kind of like that is used is more English, kind of like, and that might not be translated appropriately to the South Asian context or any kind of like other. Yeah. Sometimes that's where their difficulty is, kind of like.
So if we are talking to elders or vulnerables, or like, is any words we could use, say, like if we say your mental health,
Yeah.
I don't want to use that word, like, pagal hai.
Yeah.
Yeah,
so, like that, so those are kind of like a very
Challa ho gaya, shudai hai gaya, pagal hai gaya. Like, instead of using that word, is a wording we can use
so
and
this
address?
yeah, exactly. So I think this is what you brought out is very, very important, because these are more stigmatizing words. So instead of people seeking help are actually discouraged from seeking help. Yeah. Whereas if we say more udasi, there are kind of like words that can be used, and also normalizing the mental health is important, just like any physical health. People are not afraid to seek help if they have diabetes, hypertension, blood pressure, because they have accepted. Whereas if we can say with the age, with other changes in your environment, change in immigration status, this, with other added stress, without the things that are beyond your control, like COVID, pandemic, loss of jobs, they can cause stress. So if people understand that this is not in their power, or it's not brought in by them, it's not a sign of mental weakness, they're more likely to seek help. Yeah.
Doctors, we are my thoughts, I think my way of thinking is different. We always talk about the problem.
Yeah.
I'm a person who's not thinking about the problem and thinking about the solution. Okay, this exists. Okay, it exists. We can't do anything, but what we can do to minimize it, what we can do to rectify it, finding a corrective action is the most important thing. In our community, as a doctor, as a professional, and being a South Asian male, and lived in the society, know the up and downs, norms, what should suggest to a family member or a person, or what we should be doing to keep our mental health up? What the suggestions you will be able
I
to
think
do?
more doing the activities on a family basis, more engagement in recreational, social activities, that they are very important, as well as the religious, spiritual components. Yeah. And then I think a lot of elderly people, or some people who are new immigrants, are not even aware. They all have access to the family doctors. They all go to the family, and family doctors have dedicated counselors, so they can always seek help. But when they are unaware, they don't know. It's in the same building, so they can utilize those. Keeping in touch with the loved ones, whether in India, here, we are limited with the current COVID restrictions, but nothing is holding us from having that phone conversation on the Zoom or other those activities, at least. So there is a way of connection, and that is helpful. Yeah. Sometimes you just need to hear some good words from a loved one.
Doctor, I have another question too. You did mention the counselors, right?
Yeah.
Or mental, and you did mention they're already sitting, or they're connected with your family doctors.
Yeah.
So my question to you is, because I don't think so everyone is aware of it, or they know, is mental health consulting, or the counselor which is prescribed by the family doctor, is it covered by the Alberta Healthcare?
Yeah. So this is a little bit of more, it's a very broad and complex system. So AHS facilities, all the counseling services are covered. The counselors usually sitting in the family doctor's office is through the primary care network. They are covered. But when you go to the individual counseling, psychology, other stuff, they are not covered by your routine health benefits. Yeah. So whatever is offered most of the time at family clinics, this is offered through primary care networks. That is covered actually.
But you are a psychiatrist. I'm not talking I'm talking about the psychiatric services. So we have Alberta Health Services, then we have extended health or medical insurances through our personal medical insurance, or through employer, or through different unions, or is that if if I have a prescription, or I'm going to the psychiatrist, like I go to the massage therapy, chiropractor, or anyone, is that covered?
Yeah. All the doctors, including a psychiatrist and a specialist doctor, all the doctor services are covered through the Alberta Health. Yeah. So there is, the only thing is the counselors and the psychologists, they are not everywhere they are covered, but the doctors are covered through the Alberta Health. So they don't have to. Prescription is a different story. But medical services, the doctor services are all covered under the universal health care. Yeah.
So if I have a mental issue, like I should not be saying mental issue, like
Mental illness, yeah.
mental illness, or I'm stressed, or I'm feeling depressed, or the word I can use, I'm feeling down. If I come to you and say, doctor, do I need a prescription from my family doctor, or I can come to you directly?
No, this is so the way most of the healthcare operates is I'm a specialist doctor. Specialist doctors are usually referred through the family doctor. Yeah. But in addiction world, for example, that is not the approach we take. We take in walk-ins, because addiction, a lot of people are struggling. They don't even discuss with the family doctor. So we have kept the options open. But it can be initiated from the family doctor. And as I mentioned, to see a psychiatrist, probably 90 out of 100 don't need to have a psychiatrist. Those issues can be dealt with by the family doctor or by the counselor at their side. Where they will need the help is only 10% of the cases. Most of those cases don't, and not everybody who is struggling with mental illness needs a psychiatrist to be seen here.
You're watching Hunny Walia shows. We are talking to Dr. Aulakh. He is providing us information on mental health, what the issues could be, what could be the signs, how we can deal with it. I'm going to ask him, if you have any further question about the mental health or stress level you are going through, you are more than welcome to contact us. We will pass your questions and concerns to him, to doctor, or you can directly contact him. Doctor, in the end, what last message would you like to give to our viewers?
I think the only thing that I will say is don't shy away from talking about the mental illness. It can be, anybody can be impacted. So in fact, every third or fourth person will suffer struggles with mental illness during their lifetime. So you can imagine if you're a member of 4 in the family, so one person will be impacted by the mental illness. So it's to think that we will be immune from this is unrealistic. Help is available, but people have to initiate to ask for help. Yeah.
I agree with you, doctor. As doctor is saying, Aulakh is saying, mental health or stress level is not with the rich, poor, young, old, any age group, any male, female, any economical background could have these issues. It's just we need acceptance, we need a support. If you know someone is suffering or is showing a sign of mental illness or stress, please do consult your doctor. Please do consult your family doctor. I really appreciate Dr. Aulakh taking a time coming here and giving us enlightening us what's the difference between addiction, mental health, and stress level. Thank you. Last words. I really appreciate if you can tell us difference between addiction and the mental health and stress.
Yeah, okay. So the mental health, when we are talking about, in general people's terminology, we are talking about the depression, anxiety. Sometimes they use the word mental breakdown, schizophrenia. Whereas addiction is more struggling with the substances like alcohol, opiates, benzodiazepines. This is more something you are taking, and you're dependent on that. Yeah. So substance use, any addiction, whatever the substances we are taking, can impact our mental health. So most of the time, people who are struggling with addiction will also have concurrent mental health issues. On the other side, sometimes, not many cases, but people who have mental illnesses, they might have anxiety or other stuff, and then they are taking the substances, they feel a little bit better and they become addicted to this. So it's it can be confusing. The stress is any unexpected response to that. So for example, if I lose a loved one or I lose job, I am expected to be sad about those things. But if that response is beyond what is expected, I think that is where I'm not handling it well. Yeah.
Thank you, doctor. I really appreciate, Aulakh. You have given us so much information and knowledge, and then areas where we can think about it and be able to be more active, more open to help and seeking a help. I really, really appreciate. You're watching Hunny Walia shows. I'm your host, Sonal Fool. Till we meet again, thank you. Have a good day. Safe day.